So most people complain about this UTI. Some people, when they even treat it and they repeat the test and see if the bacteria is still there, so they get the same result over and over and over, and they start asking questions. Why? But they have taken all the medication that they're supposed to take, but the UTI is there. Let me give you some simple factors that put you at risk of getting UTI over and over again. There are some factors. One, those who are on some birth control, those who normally take a lot of pills, you automatically increase your risk of getting UTI. Those people, they automatically increase your getting UTI. And those who don't drink water at all, I beg, if you don't drink water at all, try and drink a lot of water during the day. The reason why they are saying you should drink a lot of water is when you drink water, when the bacteria get into your system, it will be washed down there. And if enough water is not in your system to, for example, to pass it out through urine to flush out the bacteria, they will hide somewhere in your urethra or your kidney or your bladder and multiply. That is the main reason why they say you should be drinking a lot of water. So the more you drink water, the more you pass urine, and most of the bacteria can be flushed through urination. And another thing is, some people hold urine for too long. I understand when you're in a car, you feel like urinating. Sometimes you can even beg the driver, or let's say you're a long journey or anywhere you are, you can find a way to pass out the urine. Don't hold it for too long. When you hold it for too long, you are just encouraging the bacteria to grow inside your urethra or your bladder. So please, those who like holding urine, for some people, when you go to work, they say, oh, let me finish this work that I'm doing. They will sit for almost 6 hours. When they feel like you need to, they will not go and urinate. They will close before they will go and urinate. I beg, don't hold your urine for too long. And kidney stone. The reason why kidney stone is a factor in what increasing your risk of getting UTI is when those stones are formed, no, it will block the urethra. So enough, or most of the water may not pass, or your bladder may not completely get rid of the urine keep in your bladder. That is why it's advisable to avoid things that will increase your risk of also getting kidney stone, especially too much sodium, and eating animal protein a lot. So when you have kidney stone, you also increase your chance of getting UTI, because the stone will go and block that part, and the urine will not flush out all the bacteria from the bladder. So please avoid things that will put you at risk of getting kidney stone. At the same time, that kidney stone can also increase your risk of getting what? UTI. And this pubic hair. Like you see, your hair will grow there. For some people, they don't really like shaving. Like you allow hair to grow there for almost, years. They will not even shave. What they are saying is that hair can serve as a ladder. It can serve as a ladder. A passage for the bacteria to what? To pass there and enter your urethra or whatever, either your vagina or your anus. That pubic hair that is there, it can serve as a ladder. The bacteria can use it as a barrier and cross over to what? Wherever they are going to cause an infection. So please, once in a while, try and shave. I'm not saying you should shave the complete, but at least shave, so that that place will not be bushy. And those who normally wear things that tie them, like some people, especially the ladies. Let me go straight, especially the ladies. Some ladies, they like wearing tight things, tight pants. No, when you are wearing those things, you are just creating an atmosphere that the bacteria can have an easy access there, and and multiply. So please, those who wear tight things will kindly avoid wearing that. Try and wear things that are loose, cotton, so that the environment will not be comfortable for the bacteria to cause any infection. And another thing is, some people have diabetic. Some people are diabetic patients. If you are diabetic patient, mm, you should be monitoring your diabetic status very well, because as soon as you're a diabetic patient, you have increased your chance of getting UTI. Those who are diabetic patients mostly get UTI, especially those who don't control it at all. So if you're a diabetic patient, make sure you control your sugar level, you take your medication. The reason why they are saying those who have diabetic also have the chance of getting UTI is, most of the bacteria, they like sugar, they feed on those sugar. So if you are a diabetic patient and that sugar pass through your system and enter your urine, or that the bacteria send the sugar in your urine, they will keep feeding on that sugar in your urine, and what will happen is they will multiply. That is why if you are a diabetic patient, try and control your diabetic, try and control it. And another thing is, um after sex, um there are some things that you need to do after sex to prevent getting UTI. Things like, after sex, you have to urinate. Like, you have to go to the washroom and wash the end. When you are washing there, no, you have to wash from the front to the back, not the back to the front, especially the ladies. When you are washing down there after sex, don't wash from the back to the front. Wash from the front to the back, so that at least you can wash the bacteria away. After you urinate, clean them nicely. Wash from the front to the back, but not back to the front. Please, the ladies should kindly take note of that. Because most people, after sex, some people, they will not even go and urinate, and they will even wash from the back to the front. Yeah, it's like you are pushing the bacteria in. You are pushing it in.